Welcome to the Regis University Doctor of Pharmacy Discovery session. My name is Dan Winnicky. I'm the Assistant Director of Admissions for Pharmacy here at Regis University in Denver. And the reason that we're here today is discuss our Doctor of Pharmacy program, talk about the highlights and what makes our program here in Denver such a unique, innovative, and very engaging program. So before we talk about the Doctor of Pharmacy program, I'd like to talk very big picture about highlights of Regis University. Regis has over 80,000 alumni. Currently, there are roughly 10,000 students involved in our program, about 2,000 of which are students that are on campus. The others are involved in various online programs. We have over 100 different program offerings, including bachelor's, master's, doctoral, and certificate programs. Regis is first and foremost a teaching university, which is very focused on offering experiential learning opportunities for our students. We have a phenomenal student-to-teacher ratio, and Regis as a university itself is over 140 years old. Regis as a university is just 1 year younger than the state of Colorado, which we're located in. For those of you who are from here, as well as those who are considering moving from out of state, it's always worth discussing what a great place Denver, Colorado is. We always like to think that Colorado is the extended campus for Regis. It is a great place to live and to learn. There's over 24 museums. Denver itself has the second largest theater complex outside of New York. It's consistently ranked the #1 best places for business and careers by Forbes magazine. As anyone who has lived here or visited here knows, it's very easy to get to Aspen, Vail, Breckenridge, Keystone, other great ski resorts, which are less than 2 hours away. Beautiful sunny place with over 300 days of sunshine, and is one of the most fittest cities in the United States. Regis is one of 27 Jesuit universities in the United States. A Jesuit defines a Catholic religious order known as the Society of Jesus. For Jesuit communities and schools around the world, including Regis University, the word establishes identity and spurs us towards a life of service and compassion. And what does it mean to be Jesuit educated? It's about developing yourself with the goal of going out and using your knowledge to improve society. Within that, there are 6 key Jesuit values. These are values that are incorporated within all programs that we have here at Regis. And the one that tends to resonate best with our pharmacy students is cura personalis. This is a Latin term which means care for the whole person. Regis University is accredited by the Higher Learning Commission, one of 6 regional accredited institutional accreditors in the United States. In addition to regional university-wide accreditation, Regis enjoys many specialized accreditations, including the Accreditation Council for Pharmacy Education, ACPE, which is the highest accreditation standard for any doctoral pharmacy program. Now, the mission of our School of Pharmacy is to deliver a comprehensive education in a contemporary, innovative environment. Our graduates start their careers ahead of their peers thanks to collaborative, active learning that matches actual pharmacy work. With a focus on caring for the whole person, cura personalis, you'll become a competent patient advocate and a principled practitioner in disease management and good health. Now, before we talk about the specifics of the Doctor of Pharmacy program here at Regis, let's talk very big picture about what pharmacists do. The field of pharmacy is diverse and growing all the time. These are 6 main areas within the field of pharmacy. Community pharmacists is what most of us are most familiar with. Community pharmacy is your typical Walgreens, CVS, or any store that you have easy access to. For most people, this is a very positive, beneficial experience because the community pharmacy is what is the most accessible aspect of healthcare across any field. Industry pharmacy are the behind-the-scenes people. These are the ones involved with researching and designing new types of drugs. Industry pharmacists are ones who are very involved with safety regulations, as well as all the marketing and research and development that goes into creating any particular pill or brand. Clinical pharmacists work in hospitals, private clinics. They can also work in community pharmacies as well. And they can be involved in preventative care as well as taking care of patients would they be there. Academic pharmacists are ones who typically are full-time or part-time. Here at Regis, our faculty, they consist of full-time faculty members as well as those who are adjunct, so part-time faculty who spend most of their week working in clinical situations, working in hospitals, working in community pharmacies, but also teaching 1 or 2 classes on the side. Informatics is a relatively niche and new area within the field of healthcare. What healthcare informatics is bridging the gap between healthcare and our computer information systems, finding ways to streamline and share digital information in order to better serve the patient. A consultant pharmacist is somebody who will advise either individuals on a one-on-one basis or provides consulting services to a series of pharmacies. In addition to that, there are some very exciting, developing, relatively niche areas within the field of pharmacy itself. This slide here shows several different areas that are various stages of development, as well as areas that are relatively new to the field of pharmacy. And on that note, if you are considering entering the field of pharmacy, a very good website to start at is Pharmacy for Me. Pharmacy for Me talks about what skills areas are a good fit for people who are considering the field of pharmacy. And there's also a pharmacy career quiz where you can enter areas of interest to you, and Pharmacy for Me will tell you which type of pharmacist you might be a good fit for. Now, within the field of pharmacy, again, as we discussed, there's several different areas which you can go into that are the main areas as well as emerging niche markets. Pharmacy itself is very lucrative in terms of pay. The median, not the average, but the median salary for a pharmacist is roughly $128,000 annually. This statistic is taken from the Bureau of Labor and Statistics. Consistently, pharmacy is considered one of the top 20 jobs for getting ahead. Now, to talk about the program here at Regis, we have a format that we say is 2 + 4. And essentially what this means, it's between 2 or 4 years of prerequisite courses required to take before starting the program. Now, please keep in mind that you don't have to have your prereqs done before you apply, but it is required that you have your prerequisites started August 1st before that start date. Our program is a 4-year-long campus-based program located at our Northwest Denver campus. And our years are divided into year 1, year 2, year 3 on campus. And then starting that summer after your 3rd year classes are over, you go to year 4, which is your advanced level rotation. Our PharmD program is 150 credit hours. What are the required prereqs? There are 72 credit hours of prerequisites, primarily in math, science, social studies, English, and various electives. Again, these just need to be completed by August 1st of that start year. Now, Regis does accept transfer credits from regionally accredited institutions. Your prereq classes must be C- or above. And on that note, if you are not sure where you stand with your prereqs, you're welcome to email me your unofficial transcripts and I'll request an evaluation. Our program itself is one of 2 pharmacy schools in the United States out of 140, which uses team-based learning in conjunction with integrated curriculum. This video will highlight what our team-based learning and integrated curriculum classes look like.
So one of the really unique things we do here at Regis is we teach in an entirely different way. We do what's called team-based learning, or TBL. So team-based learning is different than a traditional lecture where you sit in teams of 4 to 6. You're with that team for an entire semester and you work on problems, exercises, challenging situations. You work on those together with your team in class. It's an active learning process. You're not just sitting in a lecture hall trying to stay awake. You're actively engaged with people on your team, people around the classroom, with faculty. There's lots of evidence to suggest that people learn better that way, they remember things longer, and it's a more valuable use of class time. One thing that I've noticed personally is that our students seem to be excited to come to class, which is not something I thought I would ever say. It helps engage students both in the classroom and out of the classroom. One of the things that we do really well here is when we bring students together on a team, our students have different backgrounds, different experiences, and they use those experiences to work together to solve challenging problems. And one of the nice things about it is that sometimes there's a little bit of conflict, and they have to work through that conflict in a constructive, meaningful, professional way. And these are these life skills that our students learn over the course of their time here that transfer to the rest of their life. Our students in general have a much higher residency acceptance rate than other schools. We're way above the national average. I think one of the reasons why that is because our team-based learning teaches students how to be good interviewees, how to have those soft skills that helps you be successful when it comes to being a pharmacist in the real world. Knowing the chemistry and the biology and the science is one thing, but being able to communicate to physicians and physical therapists and occupational therapists, being able to do that in a professional, confident way is something we teach our students that other schools don't really do.
So that was highlighting our team-based learning. Next, I'd like to talk about our lab space. So in addition to the TBL classrooms, we have separate labs that are used by our doctorate of pharmacy students. We have a skills lab, a research lab, and a simulation lab. Skills lab is where students learn all the necessary skills that you need in order to be a practicing pharmacist. The picture on the left, we have some PharmD students who are working on some compounding, working on creating IV bags. We have research lab where under faculty supervision, you'd be able to work in an area of research of your interest. And we have a simulation lab. This is a case where you, as the pharmacy student, will go into a mock scenario and you will treat either a high fidelity mannequin or an actor in a no consequence environment. And to highlight these labs, we have another video.
I'm Cassandra Stroop, one of the pharmacy practice faculty members here in the Regis University School of Pharmacy. I'm not only a faculty member, but I'm also an alumni of the Regis School of Pharmacy. Here, we are in the Skills Lab space in Claver Hall, where the pharmacy students practice their hands-on skills. These skills and activities include pharmaceutical calculations, compounding products like lip balm, patient counseling and motivational interviewing with live actors, intravenous compounding practice, mastering patient assessments like blood pressure, monitoring, diabetes care, and asthma. Also including practicing inhaler technique with some experiences involving high fidelity mannequins. Students practice in this space not only to enhance their skills for examinations, but also to help prepare them for their experiential opportunities. Faculty from both the Department of Pharmacy Practice, PharmDs or pharmacists, but also the Department of Pharmaceutical Sciences, or PhD, give feedback to students not only in lab, but also in the sterile compounding space you see here. Students receive that individualized one-on-one feedback from not only faculty members, but also residents and alumni to ensure that they are practice-ready pharmacists and not just entry-level trained students. The Integrated Purposeful Skills Lab curriculum support Jesuit values like cura personalis and caring for the whole person, while strengthening students' ability to successfully care for their patients. The Skills Lab components are weaved into other classes that students take to solidify concepts and support overall learning. Our lab directors and faculty have been innovative and exceptional despite challenges caused by the pandemic to enhance student learning.
Hi, I'm Christine Feltman, and I am an associate professor as well as the director of experiential education here at Regis University School of Pharmacy. I am very excited to take you on a tour of our Sim Lab today. Sim stands for simulation. The goal of this Sim Lab is to allow students to have a chance of simulated experiences within a classroom environment before they have those situations in real life practice. As you begin getting into real life practice scenarios, The goal of our sim lab is to give you practice support with specific examples you may encounter. Examples include live practicing of patient counseling and motivational interviewing skills with standardized patients, or how you will handle and manage a busy community pharmacy. It can also include simulating hospital rounds with other disciplines of practice, such as nurse practitioners, nurses, physical therapy. During those, as a student pharmacist, you would provide your clinical medication therapy suggestions in conjunction with those other healthcare providers. Here's an example of one of the rooms where we would have simulated patient rounds. This includes a pharmacy team as well as nurses, nurse practitioners, physical therapists, all rounding on this patient's experience within a hospital health system. During this time, our student pharmacists would be allowed to provide their medication therapy suggestions clinically for the team that is taking care of this patient. Our patient will be a highly advanced mannequin who is set up with all of the leads ready to go with what they're experiencing in their disease state, and our team would come in and help simulate how you would manage that patient together. The goal is to provide great clinical exceptional patient care, and we follow this with our Jesuit mission of Cura Personalis, or care for the whole person, with a clinical pharmacy and nursing team. We also use our sim lab to create experiences that you may not have on rotations. For example, a patient that may have a code blue called within a hospital during a rotation, not every pharmacy student may experience that. But during simulation, we allow all students to see what would happen and what would be required if a code blue was called of the pharmacist on duty. The goal of our Simulab is to provide every healthcare student an opportunity to learn from and with each other about how to deliver exceptional patient care in a classroom learning environment. Please be sure to ask your admissions team members, other pharmacy students, and individuals you meet during your interview process about any questions you have about our Simulab. We look forward to having you as a student in this experience in the near future.
Hi, I'm Dr. Leticia Shea, and I am a pharmacy practice faculty research here at Regis, and I have the opportunity to work with our amazing pharmaceutical faculty, and we are very active in doing various research endeavors here in our research space. Here at our School of Pharmacy, we love to provide everything you need in order to be successful pharmacists upon graduation. For some of you, that may mean research, although we don't require it. If you're interested, please join us in our research endeavors. We have a diverse array of research opportunities available, from Dr. Stephanie James's research on how adults with Down syndrome respond to infectious diseases, Dr. Chris Malarkey's research on SOX2, including how the SOX2 LPS interaction may play a role in the progression to gastric cancer, to Dr. Ali Spence's research on genetic considerations in relation to how drugs are metabolized. If you join Dr. James in her research, students infect cells with a virus, then study how the virus replicates and how immune pathways respond to the virus. Dr. Spence and I are working on genetic research together, and we are always on the lookout for students that hope to join our research team. If there's one thing that can be said about Regis University, is that we're all about team learning, whether it's in our TBL classrooms or in our research space.
In addition to time that is spent in the classroom and time that is spent in the labs, PharmD students at Regis get practical hands-on experience starting as early as the second semester of the first year. So starting your second semester, 1 day a week, you're no longer in the classroom, but you're at what is called your Introductory Pharmacy Practice Experience, or IPPE for short. What an IPPE is, it is 1 day each week that a student is working either in a community or a hospital setting, getting introductory level practical experience. This happens second semester of your first year, the fall and spring semester of your second year, the fall and spring semester of your third year. Starting your fourth year, you're no longer in the classroom, but you're moving on to what is called your APPEs, your Advanced Pharmacy Practice Experience. The APPEs are 6-week-long rotations, so 6 weeks at a time, working in various clinical settings. These can be acute care, ambulatory care, community, patient care, as well as elective experiences, such as 6 weeks working in a pharmaceutical or healthcare setting overseas. The overseas option is known as the Global Health Pathway. This is a concentration that's available to pharmacy students who are seeking a rich, transformative experience working abroad with diverse populations. This is again 6 weeks at a time as part of the rotation, but is a lifetime worth of experience that you keep with you and you bring into your practice moving forward. Very integral to the Doctor of Pharmacy program at Regis and connected to our Jesuit values is the idea of service learning. So through community-based experiential service learning opportunities, students gain insight into social justice while developing professional skills in communication, leadership, and cultural intelligence. Big aspect of our identity and our values here at Regis is giving back to others. In addition to the PharmD program, students have the option of dual degree or a dual certificate. What these are is adding a few additional classes on top of your PharmD program so that you leave with your Doctor of Pharmacy and a master's degree or a graduate level certificate upon graduation. Now, what sets Regis apart are things like our 93% first-time NAPLEX pass rate, our 65% residency match rate, and a few of the places which have hired our graduates, places like Kaiser Permanente, Walgreens, Denver Health, Centura, Target, CVS, and many more. Here's a testimonial from the Director of Pharmacy at King Soopers, who has hired our Regis graduates, as well as been a preceptor to our interns during their IPI and API rotations. Our program is small and diverse. Each year, we start a cohort of roughly 55 PharmD students. Each year, we make sure that we have a diverse array of ages, as well as ethnicities and professional experiences coming into the program. The fall of 2021, on the very first day of class, Dr. Samit Shah, Dean of the School of Pharmacy at Regis, posted on his LinkedIn, "We're so delighted to welcome our newest class of pharmacy students. Collectively, they represent 23 different states, speak 13 different languages, have over 220,000 hours of work experience, 123,000 hours of pharmacy-specific work experience, and 28% are first-generation college students." Now, at Regis, there are many opportunities to get involved with campus life. As a PharmD student, you have a faculty advisor who is your point of contact for making sure that you are getting the IPI and API rotations that are a good fit for you, that you understand the material, and that you are settling comfortably into the program. In addition, the Office of Financial Aid is always here to help you to discuss ways to finance your doctoral level degree. There's a Center for Career and Professional Development. This is a place where you can practice interviewing, you can get assistance with resume writing. We have a learning commons, which will work with you for private tutoring and help you work on your writing skills. We have several pharmacy student organizations. We have a library with interlibrary loan, an excellent fitness center, great places to eat, university ministry to get involved with, and a university cycles work, as well as our outdoor adventure program. Other ways to physically get involved, as well as spiritually involved here on campus. We're always seeking to enhance, expand, and enrich college experience. We have a forward-thinking faculty. All faculty members have either a PharmD or a PhD in pharmacy. In each class that you're in, you have at least 2, upwards of 3 or 4 pharm faculty members per classroom. What are the commitments like, and what is the next step? So the investment in the Doctor of Pharmacy program at Regis is $1,005 per credit hour. This is 150 credit hours. If you break it down year by year 1, 2, and 3 is roughly 37,000, and year 4, because it starts at the end of the semester of your 3rd year, is roughly 54,000. There are minimal additional costs on top of tuition. Every student is required to have health insurance. You can have your own or get it through the university. An annual background check is required. A one-time compliance fee. This is to make sure that all your shots and health records are up to date. Books are at a minimum overall for all 4 years, between $600 and $800 total. You'll be required to have a laptop, and parking is optional. Every student is encouraged to fill out the FAFSA form to see what your eligibility for merit-based loans would be like. Additionally, Regis every year provides over 500,000 merit-based scholarships. In addition to that, there are outside organizations such as the National Association of Chain Drugstores, Safeway, Walgreens, and RX Plus, which our students are always encouraged to look at for third-party scholarship options. The way the application works is that rather than applying directly to Regis University, PharmD applicants apply through a centralized system referred to as PharmCAS. This can be found at pharmcas.org. The application typically opens midsummer, and individual pharmacy schools decide the cutoff date. For Regis, our cutoff date is March 1st. What is required for the application itself? A personal statement, all official transcripts from every university, community college, or institution you attended, at least one reference. The PCAT is optional. Within 2 weeks of your PharmCAS application being verified, Regis provides an internal application review and determines if you would be a good fit for our program. If you are determined to be a good fit and considered to be a strong candidate, you'd be invited to interview. Currently, we're conducting virtual interviews where there's a welcome from the dean, we have a faculty panel, a current student panel, multiple mini interviews, a health science reading test, and a virtual tour of our Northwest Denver campus. Thank you very much for attending. We encourage you to follow us on social media, stay in touch, reach out often. Again, my name is Dan. I'm the Assistant Director of Admissions for Pharmacy. My direct number is 303-964-6574, 303-964-6574, and my email is dwienecke@regis.edu. Thank you very much for your time and your interest. Stay well, stay happy. Take care.